So let's talk about digital tools for behavior change. You're in the doctor's office. You felt for a while that something was up with your health, but you didn't know what, and you finally had some tests run. Your doctor sits you down and she tells you that unfortunately you have condition X. But that's not all she tells you. Suddenly, you're faced with an overwhelming treatment plan, complete with medication, a new diet, and a new exercise routine. Not to mention, your life is already incredibly busy. You have no time to spare before, during, or after work. Even in quarantine, while you're working from home, your life is totally nuts. Now you have all these new things to do. You have things to monitor, like your weight. You have a complicated medication regimen where you have to take different meds in different ways at different times. And how on earth are you going to fit in exercise? You're tasked with rearranging your life around this new condition. And imagine trying to do that while you're feeling tired, you're feeling nauseous, you have these new symptoms of your condition and side effects of your medication. And imagine all of this going on in the midst of a viral pandemic, hypothetically. So we tend to think of decision-making like this, as an isolated, thoughtful decision. Well, it's really like this. We don't make decisions in a vacuum. We have all sorts of competing demands and complexities that enter our everyday lives. So I want to approach this question of how we can help patients like you, patients with condition X, through the lens of behavioral science. And behavioral science teaches us to look at people within the context of their environment to really understand what's going on. And then we can use all the benefits of technology to reach these people. And at this sweet spot where behavioral science and technology intersect, that's where we find tools like those that we're going to talk about today, commitment tools and social tools. Behavioral science is a process for understanding people, how they make judgments and decisions, how their environments influence those decisions, and it can help us appreciate the complexity of patients' lives. It's understanding that humans experience all of these things. We're prone to bias. We don't always feel motivated to make the healthy choice. Sometimes we just forget. And we make important health decisions under all sorts of suboptimal conditions. As a patient, you're dealing with condition X with all of your emotions. You might feel rushed, tired, depressed, stressed, in denial. And that's exactly why it's so important to understand the context of people's lives. When you're trying to work from home with your kids screaming, you clearly need a different health intervention than when you're relaxing alone. So if we can consider these changing contexts, we can design for people who live in the real world. And speaking of the real world, imagine how difficult it is for a patient with condition X who needs to exercise but doesn't have anywhere to do it. Maybe they live in a city where lockdown orders extend to going outside. You can't just go out and go for a jog. Or a patient with condition X who needs to eat healthy, but these adorable Girl Scouts show up at their door. Imagine they're wearing masks. The challenges that patients face are rarely due to a lack of information. That's why it's not enough, for example, to simply inform people to eat better. You know that you don't need any Girl Scout cookies, right? So tempting. But knowing that is not enough to keep you from buying and eating them. If we actually want to help people eat better, we need to intervene in their lives. We need to help people create better shopping lists. We need to help them substitute their chips with carrot sticks. We need to help them pay attention to portion size the minute that food is being served. We need to get up close and personal if we want to help that specific person in their specific situation. And technology can do a lot, actually, to help us intervene at this granular level in real time. So I'm certainly not the first to observe that we can use technology to help people manage their health. We can scale easily and cost effectively. It's not a big deal to extend the function of software to more people. We can automate things that take a lot of human effort otherwise. And of course, we can establish greater accessibility and connectedness. But aside from these obvious benefits of digital health solutions, the most important benefit of technology is that it allows caretakers to be in the right place at the right time. So people already carry their phones with them everywhere. You might even be watching this on your phone right now. They can serve as these perfect little intervention devices. And they allow us to intervene at exactly that moment of truth, right when someone is deciding what to eat. Will it be chips or will it be carrot sticks? And if your phone can remind you to take your medication or encourage you to get in your steps, then you don't need to rely so much on your memory or your motivation. And when we combine these digital health technologies with what we know about human behavior, that's where we hit the sweet spot. At this sweet spot, we can use behavioral science to understand people and their environments, and digital health technologies to help us reach them. And it's right here where we can make the greatest impact on health. There are lots of ways to work in this sweet spot, but I want to highlight a few, just a few, commitment tools and social tools. So commitment tools are special because they take these distant goals that aren't salient or motivating, and they bring them right up close to the present. People are very comfortable committing right now to something that doesn't take effect until later. We don't feel the pain of actually having to do it. In the Pattern Health platform, people sign their name to commit to their digital health program that they've created with their physician or their care manager. Implementation intentions make a commitment more specific. So they outline a trigger for a behavior to occur. So you could say, if I'm in situation A, I'll do behavior X. And when we ask heart failure patients to specify when they'll take a weight measurement, say after dinner, they're twice as likely to follow through and step on the scale. Commitment devices add a consequence if you don't follow through on your commitment. And in one version of this, users who fail to take their medication on time temporarily lose access to some apps on their phone. Naturally, this gets people to be much more adherent to the medication regimen. So commitment tools are really useful when you're targeting people who already intend to change their behavior. Social tools, on the other hand, are great when your users may need some additional persuasion. Humans are social animals. I probably don't have to tell you this. We can leverage this to help people stick to their health goals. That means that if there's a behavior that you're trying to promote, tell people that everyone is doing it. And we can use social media to bring in people's networks. We can allow people to share their commitment to their digital health program to strengthen that commitment. And finally, we can leverage real-life relationships to help people accountable to their health goals. We can notify patients' care circles, so their friends, their family, their caretakers, when they miss a health task, to allow them to step in and provide some support when they're needed. These commitment tools and social tools are just a few options at the sweet spot. So think, how could you, as a patient with condition X, benefit from these tools to help manage your condition? And as a behavioral designer, how can you work at the sweet spot to create more effective behavioral interventions? How can you use behavioral science to better understand people in the context of their lives and use digital health technologies to better reach them? Ta-da!